Hi everyone, welcome back to Hygiene and You. Since September is PCOS Awareness Month, I really wanted to do a video on PCOS and PCOD and cover some of the most frequently asked questions. For those who are new here, my name is Priyanka and my channel is about women's health and sustainable menstrual products like menstrual cups, cloth pads and period panties. So please hit the subscribe button if you would like to receive updates on my new videos. Today we have Dr. Rashmi Menon with us. Since she is based in Mumbai, I wasn't able to personally meet with her, but she was kind enough to answer all my questions and send them across, and I'll be sharing her views with you very soon. Dr. Rashmi Menon is a life coach and she specializes in reversing lifestyle diseases without medication. She's trained in homeopathy, psychotherapy, and whole food plant based nutrition. If you would like to get in touch with her, I will leave her contact details in the description box below. So let's get started. Here is a list of my questions and the response from Dr. Rashmi Menon.
Difference between PCOD and PCOS. Now PCOS means Polycystic Ovarian Syndrome and PCOD means Polycystic Ovarian Disease. So in PCOS, what happens is the ovaries produce an extra amount of androgens that are the male hormones, because of which the eggs are not formed properly and they don't release well, and some of these eggs, they start collecting fluid inside, which is called cysts, and that's why the whole disease is called Polycystic Ovarian Syndrome. And when these cysts start forming, the progression of the syndrome, you can say, is manifestation of polycystic ovarian disease. Okay, now the symptoms, the major symptoms that you see is irregular menstrual cycles. So you might find that your cycles are not coming at all. Sometimes it's more than 30 days, sometimes you miss 1 or 2 days, and in very rare cases you might find that people have frequent cycles also. The second one is you'll start seeing hair growth, like when men have during puberty, like some very thick hair on your chin, some on your belly, some on your toes and fingers, slightly thicker hair than normal. And also you'll find these small skin tags that come up on your neck and under your arms, and also thickening of the skin on all the folds like the neck, under the breast, near your groin area. And of course a lot of acne and formations on your face. Other symptoms are weight gain, although this is not in everybody who has polycystic ovarian syndrome, but it is quite common. They find it difficult. We find it difficult to lose weight if you have polycystic ovarian disease. And also thinning of the hair. Again, this is not one of the most common problem, and by itself any of these symptoms are not indicative of this disease. It is a symptom complex. Along with the blood test, you test your blood for androgens, and also the USG shows the cysts in the ovaries. That's when we confirm that this is polycystic ovarian disease, or if the hormones, just the hormones show the change, then it is along with the correlated with the clinical symptoms, then it is PCOS. Now there is no specific cause according to the regular medical background that anything causes this, but of course what we see is that there is decreased tolerance to insulin, and also there is high levels of androgens in the body. So anything that causes these two situations can be said to be causing this PCOD or PCOS. Now, if you have a family history of diabetes, we say that okay, you can have insulin resistance. You have people in your family with PCOS. Although in my personal experience, I have found that when you look at curing the disease, this really doesn't work or really matters too much whether your family history is there, whether your genetic makeup is there. So why is this becoming so common in the urban population? It's of course the lifestyle, because our lifestyle is what is creating diabetes and hormonal imbalances, the amount of chemicals that is going into our body. Now chemicals are hormone disruptors, and polycystic ovaries are a hormonal imbalance disease. So there is this direct connection there. Plus the amount of exercise that we do, the kind of stress that we have these days, the inability to handle stress, all this add up to the disease. One of the major factors, of course, is the food that we eat. We have been eating a lot of processed and chemical filled food. We are used nowadays to just buy off the racks stuff which we don't even read the ingredients of, and most of the time this is what is causing the hormonal disruption in the first place. So the reversal or the treatment has to work on those lines. Now if you look at the traditional line of treatment, it is said in the traditional line that PCOD or PCOS cannot be reversed, cannot be completely cured. But I have seen in my personal experience, in my clinical experience, that it can be done. The clue lies in changing the causes, in changing the lifestyle, having a healthy, whole food, plant-based food habits, having enough exercise, eliminating chemicals from your food and environment, and basically having an exercise routine and having good thoughts, meditation. All these things can actually help you reverse the disease. Of course, eating organic plays a huge role here because we have to keep the chemicals as less as possible. So the traditional approach is to give medicines which are hormone regulators, the contraceptive pills, and also to give medicines which can suppress the androgens. Of course, when this is too big, then you can have surgery to remove them. But again, that is not hitting on the core cause of the disease. So for eliminating the core cause of the disease, even if you may have to undergo an emergency stopgap treatment of the pills or the surgery, I would recommend that you eliminate all kinds of processed food from your diet, all kinds of animal products including dairy, especially dairy because dairy contains all the female hormones which create the imbalance of your ovaries in the first place. And next would be to eliminate all kinds of direct sugar and oil. This not only jumps up your metabolism but also affects your insulin resistance. And the next would be to clean your toiletries, your perfumes. Everything has to be as chemical free as possible by organic food, and inculcate a good exercise regimen which is regular, and have a meditation practice or any other stress relieving exercise. Okay, many women who come to me with the polycystic ovaries, their main concern seems to be weight gain and the inability to lose weight. But I would suggest that do not focus on the weight too much, because not everyone with PCO has weight gain issues. So the idea would be to balance the hormonal levels and to remove the root cause of the disease. So weight loss becomes a happy byproduct of it. And that will happen once your body starts getting healthy and healthy. Polycystic ovaries also make it a little bit difficult to conceive because finally if the eggs are not of superior quality, it is natural that conception is difficult. But again, when I look at the holistic element, instead of going for the fertility treatments, which again will be a dose of hormones in your body, creating the imbalance in the body, I believe that the body has the ability to heal itself, provided we give it the right conditions. And going on a healthy lifestyle and a holistic approach, we can achieve that. And once that is achieved, the hormonal levels are going to be as balanced as possible, and the possibility of conception naturally is always there. Now the duration of cure depends from individual to individual, but it is possible provided you take this seriously and actually take this in your hand, that okay, I need to change my lifestyle to create a change in my disease. So if the want for change is good in you, then you will make the change very easily.